Hey family, welcome back to Community Medicine, a channel where we discuss matters health. We are in a cold and rainy season, so our children are at a more increased risk of developing or acquiring pneumonia. So today we shall be looking at pneumonia in children. If you have a young one at home, make sure that you join me till the end. So welcome back. Thank you very much for your continued support. Kindly don't forget to subscribe, to like and to share this video. So what is pneumonia? So pneumonia is infection of the lungs, which can bring about inflammation of the air sacs. So our lungs are made up of air sacs, or air sacs that we normally refer to as the alveoli. So in a healthy individual, these air sacs would fill with air when one is breathing. But in case one has pneumonia, these air sacs would fill with pus or fluid, and this would make breathing difficult and painful. So pneumonia is the single largest infectious cause of death in children below 5 years in Kenya and even worldwide. And it's normally caused by various bacteria, viruses, fungi, and even through aspiration of liquid or fluids. This is what we normally refer to as aspiration pneumonia. And it can also happen in newborns in case they aspirate the meconium during delivery. So transmission of pneumonia is through can be through airborne droplets, that is during through coughing or sneezing, and then it can also happen through blood, that is during delivery or shortly after delivery, that is in newborns. And then in case your child has bacteria or viruses in their airway or in the throat, in case these bacteria or the viruses are inhaled, the child can end up acquiring pneumonia. So various strains of bacteria and viruses normally cause pneumonia in various age groups. For example, for a newborn below 3 months, the most causative bacteria are the E. coli, we have the group B streptococcus, and we also have the chlamydia. And then 3 months to 5 years, the most common causative organisms are actually the virus, like the parainfluenza, the influenza, Haemophilus influenza, RSV. But we also have bacteria like the strep pneumoniae, staph aureus. 5 years and older, the most common ones are the adenovirus, the mycoplasma pneumoniae, streptococcal pneumoniae. So which children are at a more increased risk of developing pneumonia? In case your child is immunocompromised, that is if they are having a reduced immune system, which could be due to chronic conditions like HIV, in case your child was born with HIV, or if they have other congenital or other chronic conditions, they would have a reduced immune system. If your child is not breastfeeding properly, or if your child was born with a low birth weight, this can also put one at a risk of acquiring pneumonia. And if your child is malnourished, and also if your child is exposed to tobacco, for example, if your parent or your neighbors, you're in an environment where the neighbors do smoke, all these can increase the risk of developing pneumonia. So what are the signs and symptoms that you as a mother or a guardian need to look out for in your kid, which can point out towards pneumonia? So if the child may have just cough and fever, so this could just be a cough if there are no other signs and symptoms, especially the respiratory signs and symptoms, and the cough can go away, especially if this child has a strong immune system. They'll be able to fight off this cough. But if the cough progresses to respiratory symptoms like fast breathing, which can be seen in a child's chest cavity, you'll find that the chest is moving up and down very fast. And then you have a lower chest wall in drawing, whereby you find that the lower part of the child's chest will be moving inwardly when they're breathing. Yet in a healthy individual, the chest cavity should move outwardly or outward when one is breathing in. And then you have nasal flaring, whereby you find that the nostrils are moving, like they're moving up when the child is breathing in, meaning that they're in respiratory distress. And you have other symptoms like grunting. The child may produce a grunting sound. And then this child may not be able to feed. In case it's a child who is able to express themselves, they may complain of chest pain or pain when they are coughing. And you may find that the child is not able to play. They are just lethargic, they are just dull and inactive. And in severe cases, you may find that the child may become unconscious, the child may start convulsing. Yeah, so all these are signs and symptoms that you need to look out for in your child, and make sure that in case you identify them, you need to go to the hospital. The doctor or the healthcare provider will take a detailed history, will do a physical examination, and this way they'll be able to come up with the right diagnosis. They may order some tests like the chest x-ray, complete blood count. Yeah, so management of pneumonia is by the use of antibiotics or antivirals for the viral pneumonia. You have pain management, fever management. But in severe cases, this child may need to be admitted in order to receive intravenous antibiotics. They may need oxygen supplementation, proper nutrition counseling, adequate rest. They may also need to be rehydrated. Yeah, so, and they'll also receive fever and pain management. So make sure that you take your child to the hospital, and this way they'll be treated correctly. So how do you avoid your child, or how do you reduce the chances of your child acquiring pneumonia? This can be done through ensuring that you keep your baby warm. Make sure that your baby gets vaccinated against pneumococcal as per the guidelines. Make sure that you breastfeed your baby exclusively for the first 6 months. This way you'll be able to boost or to build your child's immunity. Incorporate fruits and vegetables and fluids in your child's diet. Adequate nutrition is very key in building a child's immunity. And address environmental factors like making sure that your child is not exposed to tobacco. Thank you very much for your time. Don't forget to subscribe, to like, and to share this video. Bye bye.